Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for returning for another segment. We're going to be speaking with Dr. Abi Sundaramoorthy this morning. She's joining us here from Somatus. It's a kidney care company to talk about the collaboration of her company with Anthem to find kidney patients in stage 3 before major kidney damage occurs. She's also going to touch on how these patients will be identified and guided to effective protective treatments, what this means for their doctors and nephrologists, and how practitioners can extend their reach, breaking down socioeconomic and racial barriers. Welcome to Health Professional Radio, Doctor. How are you?
Good. How are you, Neil? Pleasure to be here.
Thank you for joining this morning. Well, I did mention, of course, that you're joining us here from Somatus. Give us a bit of your professional background and talk about your role there.
Yeah, thank you very much. So I am a board-certified internist. I trained in my internal medicine residency at Case Western Reserve University in Northeast Ohio. Prior to this role at Somatus, I did serve as a chief medical officer for University Hospitals, which is a large health system in Northeast Ohio, and then did move into a role as system clinical value officer at UH, working for one of the largest ACOs in the country on value-based care initiatives. Soon after, I was blessed to be able to join the Somatus team and currently serve as the executive vice president for the clinical enterprise here at Somatus. A little background on our company and what we do. Somatus is a national value-based care company, really here to serve patients with underlying kidney disease, both chronic kidney disease as well as ESKD or end-stage kidney disease. We partner with multiple health plans in greater than 30 states across the United States, serving over 150,000 lives. We really work with payers and providers to decrease unnecessary utilization of acute care services for these patients and delay overall disease progression for these patients with underlying kidney disease, all while optimizing outcomes and quality of life for the members that we serve.
Now, why is that relevant for health professionals, and which health professionals benefit from those services?
Yeah, that's a great question. So this is relevant for health professionals. Specifically, I'll touch on two types: primary care providers, which is where identification of these patients starts, and then nephrologists, who are the specialists that care for these patients as well. So as everyone is aware, patients trust their doctor to prevent disease progression and improve their overall outcomes. Oftentimes, patients don't know how preventable their disease process may be, and they really rely on their physicians to be able to modify any risk factors that could prevent them from progressing rapidly. In early stages of kidney disease, patients are largely cared for by their primary care providers. So there are some things that are relevant to primary care providers, and we really lean on them to be able to drive better outcomes for these patients. Number one is identifying these patients early on. So a lot of the national statistics show that 37 million U.S. adults have underlying kidney disease, with many of these patients not even knowing that they have kidney disease. What this leads to is a higher rate of patients with end-stage kidney disease requiring dialysis. In fact, the CDC shows that every 24 hours, approximately 360 people begin dialysis for the first time. High blood pressure and diabetes are leading causes for kidney failure, representing 3 out of 4 new cases that occur. And these are highly modifiable as they're managed by providers and patients together. So in the early stages, identifying these patients and letting them know that they have underlying kidney disease can really change the course of the patient's disease and their outcomes. This is done through the measurement of a lab called eGFR. By using this, we can understand where in the classification system the patient falls and what are the appropriate interventions that need to be deployed by the provider in order to delay disease progression or even prevent disease progression. Identifying these patients early for a PCP also allows them to refer to the specialist, in this case, the nephrologist, early on. There are specific factors, clinical risk factors, that tell us who needs a specialist referral. This includes things such as rate of eGFR decline, high levels of proteinuria, amongst other risk factors as well. So PCPs knowing this, understanding these guidelines, and being able to refer to a nephrologist is key in this stage. Another key component that we lean on our generalists to provide at this stage, which is early in kidney disease, is medication management. So data shows that 49% of patients, or upwards of 49% of patients who have underlying kidney disease, are still on nephrotoxic medications that can harm their kidneys further. Many of these patients are on medications without renal dosing, which means taking into account their kidney disease and decreasing that dose appropriately. And then many of them can benefit from what we call disease-modifying drugs. One example, a more recent example, is SGLT2 inhibitors. There has been a lot of research around this showing that in the earlier stages of kidney disease, putting patients on this type of drug can reduce mortality by upwards of 20% and reduce disease progression to ESKD by upwards of 30%. So having PCPs start these types of medications can really change the course of illness for these patients. And another key component at this time would be intensive comorbidity management. So as we had talked about, 3 out of 4 patients who progress to end-stage kidney disease have the causes are high blood pressure or uncontrolled blood pressure, as well as unmanaged diabetes. In this stage of disease, primary care providers, by really tightly managing these comorbidities, can prevent that disease progression. Moving on to nephrologists, when it comes to the nephrologist community, really helping to move away from end-stage kidney disease management and in-center care, more towards upstream prevention of disease progression by these specialists can really do justice for these patients. This includes things such as earlier identification of these patients so that we could do more robust transplant referrals. Those patients who do qualify for a transplant should get plugged in early, as we've seen much improved outcomes in these patients. Another key component would be an earlier focus on home modalities, meaning instead of starting a patient on in-center dialysis, getting them started on home peritoneal dialysis or home hemodialysis has also shown improved outcomes. And then finally, optimal ESKD starts, meaning appropriate timing of durable or permanent access for patients who need hemodialysis using an AV graft or an AV fistula rather than a CVC, which can lead to infections, is important in improving outcomes, as well as starting in the outpatient setting instead of crashing into dialysis in hospital can also improve outcomes for these patients.
How is Somatus going to employ these strategies based on some of the challenges in identifying these patients in the first place? Could you describe some of those challenges and what Somatus is doing to overcome them?
Yeah, that's a great question, Neil. So, one of the biggest challenges is having the richness of data to be able to identify these patients early. That was one of the first things that Somatus seek to tackle. So by partnering with our payers, we're able to get claims data, which allows us to see into coding and documentation from several different sources, whether that's the primary care provider, it's a specialist, it's a hospital setting, and we can understand what stage this patient is likely in. But we also augment that with real-time data, so from EMR records, from state health information exchange, from census data. We partner with lab companies, pharmaceutical companies, and we can really accurately diagnose exactly which stage of kidney disease this patient is in. This empowers us to be able to educate both the provider as well as the patient on their kidney disease so that everyone is aware in terms of where the patient is at, and they can take appropriate interventions. Once we have that, we can then engage both the patient and the provider and help curate a customized set of interventions that's going to help delay disease progression.
Talking about partnering with payers, Anthem is a new collaboration specifically entered into to address this issue. Is that correct?
Yes, absolutely. They've been a great partner and is a new collaboration for us already with a very rich source of data that allows us to drive our predictive analytics and our machine learning modules to be able to identify these patients, apply our risk stratification, as well as our interventions appropriately.
Well, doctor, is there anything that you'd like to add?
Yeah, absolutely. Lessons learned from this patient population is basically national studies show that greater than 50% of patients with underlying kidney disease have accelerated disease progression. That means 1 in 2 patients with kidney disease have modifiable risk factors that add to a quicker disease progression than they need to have. The U.S. healthcare system is much too advanced to take a reactive curative approach to managing these types of patients. At Somatus, we aim to take a proactive, preventative approach to managing these patients. This includes things such as medication management, comorbidity management, patient education, patient activation, socio-economic risk mitigation, care coordination, and really looking into health disparities and creating a sense of equity that comes from them. By implementing all of these, we've brought this number down to less than 30% of our patient population having accelerated disease progression. We believe that as a society, with the input of payers, providers, value-based care companies like ours, and policymakers, we can bring this number down to 0. And that's really our mission and vision of the organization.
Give us a website where we can learn more, if you would.
Yeah, absolutely. To learn more, please log on to www.somatus.com.
Great. And that's SOMATUS.com, correct?
Correct.
Doctor, it's been a pleasure speaking with you. Thank you so much for taking the time, and I'm looking forward to our next conversation.
Thank you, Neil. Have a great day.
You as well. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Abi Sundaramoorthy. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.